Greetings from Washington, D.C. This is Peter Thomas with the National Association for the Advancement of Orthotics and Prosthetics. There's so much happening in Washington at the beginning of 2015 that I thought I'd take a moment just to give you a survey of what's taking place, what's going on over the next 2 months. We just heard from the President in terms of the State of the Union address, where he laid out a fair amount of his goals for the remainder of the year, and frankly the remainder of his presidential term. The next major item that occurs, or the next major development, is the release of the President's federal budget on February 2nd. That's an annual process where the President lays out his spending priorities and the Congress accepts them and then goes to work. Normally, the President's budget in recent years has been what they call dead on arrival. It really has not gotten or seen the light of day. And that's expected to be the case this year as well, especially now that you've got a Republican-led Senate and a Republican-led House. Nonetheless, the release of that federal budget starts the annual appropriations process, and the House and Senate are now tasked with coming out with their own versions of their budgets, and they certainly will do that. In the past several years, the Democratic Senate in particular has not passed some budgets, and one of the reasons was the fact that they had come to some separate spending deals that had outlined spending anyway. But the fact is that the Republican House and Senate are expected to produce a budget. Whether they can agree on a joint budget resolution and whether they go forward with an omnibus spending bill, which would allow, or rather an OBRA bill, which basically would allow them to only need to achieve 51 votes in the Senate to pass very significant legislation, is anyone's guess at this point. The Republican Party is still debating whether to use that budget mechanism in order to advance their agenda. The next big development will come at the end of March, or frankly will happen over the next 8 to 9 weeks. That development is an ending or an expiration to the current treatment of the physician fee schedule under Medicare, which has again held harmless physician fees where they currently are, rather than giving physicians a 25 to 27% cut. It's called the SGR, the Sustainable Growth Rate Formula, and Congress is expected to try to reform that SGR formula once and for all. It's very unlikely at this point that they'll be able to get a permanent fix through the Congress. That would cost about $140 billion over 10 years. And there are certain extenders that go along with that, like the therapy caps that you may have heard of. And all those extenders combined total between $40 and $50 billion per year. So they need to raise about $190 to $200 billion over 10 years to offset the cost of a permanent SGR fix. And that's very unlikely to occur over the next 2 months. So we're back to the same old song. It looks like they will probably punt and pass some kind of short-term extension on the physician fee schedule, which will cost significantly less than $200 billion, and try to figure out other ways to pay for a short-term fix. Orthotics and prosthetics, like any other provider group, is at risk when they start looking for ways to offset the cost of the Medicare program, and will remain vigilant to make sure that NAAOP represents your interests in that debate. The final thing I want to talk about is orthotic and prosthetic legislation. There's been a number of bills that have been introduced in the past Congress, and this is a new Congress, so all those bills need to be reintroduced if they're going to have any future life. You should know that the O&P organizations and NAAOP, working in concert with AOPA and with the O&P Alliance organizations, is working hard on revising those bills and trying to come up with the most likely bills to see actual movement in this Congress. And we'll be reporting back to you once we have more details on that issue. Until then, thanks so much, and we'll see you next month.